I just did a whole segment on medical directorship. If you did not see that video, you need to go back and watch it because this video right here is going to be an extension of that, and I'm going to talk to you about delegation and responsibilities of medical directors. Stay tuned. And so, as we previously talked about in the other video, the medical director bears the ultimate responsibility in all medical treatments and all patients. And they are the one to ensure that your med spa or aesthetic business is practicing safe and effectively, okay? And I want you guys to remember that a medical director, it depends on the state, but whoever the state has identified as a medical provider, that is who can be your medical director. Some key things you must know though: they have to possess the training and experience to safely administer those treatments. What does that mean? You cannot have a doctor who is internal medicine being your medical director if they have no knowledge of dermal fillers or neurotoxins. They had to have at least trained on them in order to effectively and safely supervise any of their healthcare team. So if you find that have a medical director, it's fine if they're internal medicine, long as they have trained. They have to have the knowledge in order to sign off on the protocols and review the protocols and actually understand them. Why? Because ultimately they accept responsibility of the safety of the public, and in this case, your aesthetic patients. Another reason is that they have to ensure that the other medical practitioners and providers are adequately trained. From the MA, if there is an LVN that works there, the RN, it is up to them to make sure they are trained and they are qualified in order to provide any type of services and treatment to their patient population. Another thing that is not often thought about is they have to be in the position to assure that the med spa is equipped with all of the medical supplies. Now listen, we know that doctors delegate this, right? But when it comes to creating the protocols, when it comes to the SOPs for it, they are the ones involved. And most importantly, they have to be involved with the worst case scenario. So we have to think about what protocols are written in case an emergency happens, whether it's a vascular occlusion, whether it's allergic reaction, and they are the ones who have to sign off on those. This is why it's not just a matter of getting a doctor or a nurse practitioner, if it's a full practice state, to be your medical director, but rather being able to find the right person who can properly support you and supervise the medical treatments that you are providing. Okay, they have to have oversight in every medical aspect of the business. Now, keep in mind, we know doctors don't go and count how many syringes and things like that, but that's being delegated. They still have to be involved with how that is done, with when the supplies are done, accepting responsibilities of a medical director, and they are not properly trained in not one, but every single medical treatment that's being offered puts their license as well as your license at risk. And I cannot stress that enough, you guys. It is negligent for them to supervise treatments if they have not been trained on them or they're not qualified to actually do the treatments themselves. If they do not have those proper training, and if they do not properly supervise your med spa, you are putting your med spa at risk. And so you want to set it up appropriately. Again, you guys, it may seem intimidating, but if you look at it like it's a partnership between the nurses and the physicians, and we are creating something to provide an experience and to provide treatments to our patients, that we can do this efficiently and safely, then it's a no-brainer. But when you try to cut corners and you put yourself in a position where it's like you're renting the doctor's license and they don't have adequate oversight and supervision and they're really not involved in your business, that puts you and your business at risk. Hey, I caught it down to less than 5 minutes. I'm winning today. Again, you guys, make sure you like and subscribe if you found some value in this video. Also, don't gatekeep. Share, you guys. Share with other nurses, other nurse entrepreneurs. My name is Dr. Kiiyonna Jones. I have links to my other pages that I have as well. And I just look forward to seeing the comments, especially if you found this valuable. I would look forward to seeing that and any other questions that you have. Until next time, you guys. Bye.